M42 is one-of-a-kind global tech-based health company. It was formed by the union of G42 Healthcare's capabilities in artificial intelligence, multiomics, biobank, digital health, and Mubadala Health's state-of-the-art services for patient services. The traditional way of healthcare needed to change. The costs were going up. Access to healthcare was being difficult post-COVID. Staff was at shortage, and hence the union of AI technologies, multiomics together with patient services was much needed at the hour. And it was for us to just stop, think, and realize we have to look at healthcare holistically as health and not just generally as healthcare. And that was one of the reasons M42 Healthcare was born. From my perspective, there's no other company in the world like M42, all the way from artificial intelligence, genomics, biobank, environmental science, to IVF, primary care, tertiary care, all together under one roof. We have 450 facilities in 26 different countries with over 20,000 employees to holistically find solutions in precision, preventive, and personalized medicine.
As we see today, the amount of data being generated in healthcare is increasing really fast. It's estimated that by 2025, there will be 11,000 exabytes of healthcare data, more than any other industry in the world. It's therefore important that we have efficient methods of not only analyzing these data, but being able to extract actionable insights from these for many different applications in healthcare. Med42 is an open-access clinical large language model built by M42. It's one of the world's most performant open-access models for clinical applications. It provides high-quality answers to clinical questions. The instruction tuning dataset was curated by the M42 team here and reviewed by our network of expert physicians. It's really that physician feedback that we brought into the mix that helps us create again a very high quality source of clinical question and answer pairs. It is expected that with such changes, we'll be able to reduce the administrative burden by up to 50% while improving the experience of delivering care for the physicians by up to 70%.
Technology is having a major impact on everything we do. The way I think of it is in two large buckets. One is we're using technology in new ways to allow us to detect and prevent cancer in ways that were not possible. The other is in the use of technology to improve the treatment in the care we deliver. In terms of diagnostics and detection of cancer, we have artificial intelligence algorithms that sit alongside our expert radiologists and improve their ability to detect precancerous lesions at a rate that was not possible before. In the realm of treatment, we have many new developments that's improving the way we care for patients. One is in robotic surgery. So instead of using long incisions for cancer surgery, as was typically required, now we're using very small incisions and very precise tools that are allowing patients to recover faster than ever. We're also using artificial intelligence in our radiation oncology program. The system replans the radiation treatment for the patient each day they're getting treatment. This is making the treatment more precise and having less side effects than we've ever seen before. Another area where new technology is really changing the way we care for patients is in the area of wearables. These are small devices that allow us to measure in real time, 24 hours a day, to predict adverse events for patients who are currently receiving cancer treatment. Knowing that a patient has an impending problem, it allows us to intervene earlier and keep them out of the hospital. We were asked and had the privilege for the last 4.5 years to lead the flagship program for the Emirati Genome Project, to do genetic sequencing on the entire population of Emiratis. And we've made some very exciting developments with the use of this information in safe ways, with patient consent, to actually bring this information for the first time to the bedside to improve the care of patients. And then finally, all of this, because of the impact on prevention and improvements in treatment, we anticipate will lower the cost of care and make care more affordable for all patients. We'll be transferring more care into the home environment where patients can be supported by their family and loved ones, and it reduce the need for acute care hospitals through technology, and we're very excited about this.
With the help of these advanced AI tools, we hope to empower the end users to be able to ask any kind of questions that they want and get the insights that they want in a very fast manner while abstracting away the complexities of analyzing these datasets. It's our strategic vision being executed by the world-class talent that M42 brings together, paired by the state-of-the-art facilities that M42 has in its network that will help us build transformative new technologies to deliver world-class care to our patients.
Now we're seeing startups and other companies actually coming into the region in unprecedented numbers. We have the opportunity to meet with these companies and discuss with them how to implement all this new technology right here in Abu Dhabi so we can lead the way in improving the healthcare for the world.
I think the part that finally excites me to be part of M42 is we are an organization that is focused on sustainable future of health. We're looking at health and not just healthcare, looking at prevention and not a cure, and looking at people and not just patients.